Good afternoon, everybody. I'm Kristen Fanachero from the University of Michigan School of Information, and we are so excited to have you here for our latest monthly webinar in the Cutting Edge Librarianship webinar series. Today's topic is on social work in public libraries, and I'm really thrilled that Tiffany Russell is here from the Niles District Library in Niles, Michigan. If you are not familiar with Southwestern Michigan, this is a really special library that has always had a big commitment to meeting the social services needs of its community. And Tiffany is part of a specially funded pilot project to extend that work more formally by working with trained social workers. And different from how larger urban library systems have approached things, there's a different model here that I don't want to spoil for you that she'll be exploring. We want to do a special shout out here to our sponsors, the U of M School of Information, the Library of Michigan, and IMLS. The Library of Michigan and IMLS funding not only makes this webinar series possible, but they also funded Tiffany's project that she'll be spending time talking about in this session. Throughout the session, make sure that you find the chat window and the chat icon to open the window. I'll be keeping track of any questions you have. And we see there's a big variety of institutions recognized in terms of size and purpose and scope. And a lively chat window really helps people customize content for what they're looking for. We will have time for questions and answers as well. It's really great to see some familiar names and some new names. So I will turn it over to Tiffany, and I'll be in the chat if you need me. Thanks.
Thank you. Good afternoon, everyone. Thank you all for taking the time to join the webinar this afternoon, and special thanks to Kristen for giving me the opportunity to speak about something that I am loving right now, and something that is becoming one of my greatest passions. So I'm really appreciative of the time and of everyone taking the time out to listen in on what we're doing. So again, my name is Tiffany Russell, and I am a graduate of Western Michigan University. I graduated from there with my bachelor's and my master's degree. I'm a licensed clinical social worker here in the state of Michigan. I was born and raised here in Southwest Michigan, lived here all my life. I have over 15 years of social work experience. Some of the things that I've done include medical social work and some community mental health things as well. And I am currently the social services manager at Niles District Library. So I want to just jump right in and talk about some common questions. And you will see my little puzzled emoji face there when I tell people that I work at the library. That's normally the look that I get, particularly from people that I've graduated with or went to school with, because they are puzzled by the fact that I'm a social worker, but I work at the library. So I often get the question, I thought you were a social worker. And I have to remind them that, yes, I still am a social worker. So I also have to do some explaining about what it is that I'm doing as a social worker who is employed by a library. The library social work, it's an emerging field. Social workers and interns, actually, we are housed in and we work out of a public or community library. We are delivering social service related support and assistance to the public, and that includes library patrons and non-patrons. Our efforts are influenced by libraries' unique community needs in the community context, in a range of activities and services being offered across the spectrum of library social work. We also serve as social service resource liaisons for library employees and collateral partners in library-based activities. So there's so many questions that people ask, and some of those I have listed here. What exactly do you do? How are you funded? Do you do counseling? Do people have to pay? So many questions about being a social worker in a library. So rather than answer each one line by line, my hope is that throughout this hour, All of these questions will be answered. And if you do have questions, as Kristen mentioned, please feel free to type them in the chat. I want to spend a little time talking about the history of social work in public libraries. And I must pay homage to the first social worker in a public library full-time, who was hired in 2009, and that is Leah Esquera. She was hired at the San Francisco Library as part of a homeless outreach services partnership. And she's actually still working there. And then around the same time, San Jose Public Library hired a caseworker, and they were staffed by volunteer social workers who offered twice a month, 20-minute free referrals to people. In 2011, Edmonton Public Library, which is in Canada, hired a social worker, and they adapted from the same San Francisco model. In 2014, several libraries came on board with hiring social workers, and those libraries include Denver Public Library, Kansas City, Washington, D.C., New York Public Library, Sacramento Public Library, and Baltimore. And all of those places still have social workers employed in their systems to this day. And just a little bit more about the history there. 2015, 16, 17, and 18, Addison Public Library, Oak Park, which is in Illinois. Evanston is also in Illinois. They added social workers there as well. In 2017, Kalamazoo Public Library had peer support navigators. And peer support navigators are different than social workers in the way that they are people who have actually lived with the experiences of people that they serve. So you may have a person who formerly experienced homelessness, or someone who is recovering from an addiction. So that is what a peer support navigator is. And the benefit of having a peer support navigator has shown to be great, because you have someone who can relate to what someone else is going through on a personal level. Then in 2017 and until 2018, the Niles District Library here hosted a BSW student, and that expanded into 2018 with our 3-year grant. And that funds me, the MSW, Social Service Manager, and we have the ability to host up to 3 interns as well. So as we move forward through the presentation, I will talk more about the program. And as of the present time, there are social workers being utilized across the country. So there are social workers or social work interns in Florida, New York, Arkansas, Illinois, Texas, Denver, Washington, D.C., and Michigan. And I'm sure I left off some, but it is becoming quite popular across the country. There's even social workers in libraries in Australia. I think that's an interesting point to mention as well. So why social workers? Of all the careers, of all the professions, why a social worker in a library? So I just want to speak about social workers and the work that we do. So social work, it's a broad profession, and we are seeking to help people interact more effectively with one another and within their environment and the community. We assist individuals with problems related to meeting basic needs. So things like employment, getting adequate income level, healthcare, family relationships, and even mental health. We seek to identify and correct both individual and social causes of problems. And by doing that, we have this thing where we call a person-environment perspective. And so what that means basically is that people respond to what their environment is. And based on their environment, they may have certain barriers or certain limitations to access services or getting the help that they need. So we also are able to identify people who need help. We can assist individuals and families in meeting those needs by connecting them to different resources, food assistance, childcare, healthcare, and other things. We also are able to help clients or patrons navigate government assistance and benefit programs such as Medicaid, Social Security, disability, and food assistance programs as well. So we bring a level of assisting people with navigating the community, navigating resources, navigating the social service world. And our focus is to help and advocate for people to make sure that they're getting the services that they are needing on an individual level. When you think about social work versus librarianship, and even for me, I remember thinking about working at the library, and I thought that, wow, what a difference in between the two professions. But actually, we have more in common than you might think. So I've listed here the social work core values and the librarianship core values. And if you browse the list, you will see that there are some similarities. So in social work, our core values are service, social justice, dignity and worth of the person, importance of human relationships, integrity, and competence. And then under librarianship, there's a few more than social work, but there's access, confidentiality and privacy, democracy, diversity, the public good, professionalism, service, social responsibility, sustainability. And so I put the puzzle pieces there because what I like to envision is the connection between our core values aligning so that it will support the interdisciplinary collaboration between the two. So we're not as different as what you may think. So Kristen kind of talked about earlier urban and rural libraries. And so I do want to take a few minutes just to talk about what social work may look like in an urban area and what social work may look like in a rural area. And I do want to remind you that if you have any questions, feel free to type them, and maybe we'll take a break as well to ask if there's any questions so far. So when you think about how social work can look in different environments, especially urban and rural, there's quite a few differences. Currently, urban areas and larger cities utilize social workers probably more than the rural areas. However, there's still a need in both. So in social work and urban libraries, these are some of the things that you may see social workers doing or being engaged in. Services for homeless and indigent patrons, supplies and resources. And I'll have to tell you that this is probably the most popular thing, especially in larger cities. So in cities such as San Francisco, Washington, D.C., New York, those places have a larger population of people experiencing homelessness. And so the social workers there may be more engaged with outreach and doing services and participating in things that will help people to kind of combat that issue. Other things that social workers in urban libraries are doing: crisis response and intervention, overdose, substance use, trauma, PTSD, things like that. They're also doing resource and referral to community resources such as housing, IDs, food, shelters, hygiene, and medical assistance. In the urban libraries, you will see more of a limited or targeted case management services. And so that is probably another significant difference between the urban and the rural libraries. And when I speak about case management, I mean You are linking people with services. You are doing the advocating. You are connecting them and following through, and they have ongoing standing appointments with you. So in the larger cities, some of the social work programs are designed for that type of service. Social workers in urban libraries are also doing training and education to library staff on various topics, including mental health, substance use, immigration issues and assistance. They're also doing some community outreach, engagement, and education as well. And then they're providing the links to education and training to other public services. So then there's the other perspective of social work in rural libraries. And so this is more in line with what our project is. So a big thing that we do is resource and referral to community resources. So we are connecting people to those resources such as housing, legal, food, homeless and domestic violence shelters, mental health services, transportation, pending evictions, child support hearing assistance, and much more. Also, we assist people with filing or applying for services. We also do some crisis response as well as employment applications, online filing of grievances, complaints, or service denial appeals. The one thing I want to say is within the rural library, and I just was talking to an intern about this, is that for us, we often don't know what someone is going to come in and ask for assistance with. So within a larger city, if you're a social worker and you are hired there to focus on people experiencing homelessness, then you kind of know what kind of people you will engage with and what your work might be. For us, we never know what kind of issue people are going to come in with. And we see a variety of things as well. So I think that is something that stands out in terms of rural versus urban libraries and social workers. Some other things that you will see from social workers in rural libraries: helping people complete a FAFSA application, accessing support services for diabetes supplies, vision and hearing supplies, emergency dental services, parenting time and family reunification and visitation sites. I will say that libraries in the rural areas are often sites for those type of things. So we will often see people coming in doing a visitation with a caseworker and a parent and a non-custodial parent. So we often see those type of things happening. And then also we do education and trainings for library staff on things like mental health, poverty, homelessness, substance abuse, and trauma, and also just how to deal with people that may be coming in that may present with challenges. So I want to talk a little bit about our program specifically. And our program is Social Workers in Rural and Small Libraries. And if you're brave, you can try to pronounce the Swirsel thing there underneath. So as I mentioned, we had a pilot program, and that started in June of 2017. And we had a bachelor's level intern. And if I could speak anything and say anything about that program, was that was really an eye-opener in terms of seeing how beneficial a social worker could be here at the library. It was so beneficial and so helpful that it led to our director, Nancy, who has retired now. It led her to write a grant and submit that grant. And not only that, but as she was writing the grant, she thought about, I wonder if there are any other libraries in our area that are going through this or that see a need as well. So she reached out to several libraries in our area and got an overwhelming response. And so because of that response, we have 6 partner libraries in our area that we work with. So when she sent that out to them, they all responded and said, yes, we see the same thing. We see people coming in with questions, with concerns, with things that we're not really sure how to direct them, and we would love to be a part of this program. And so she submitted the grant, and then in May of 2018 is when I came on board. In September is when we had our first round of interns begin, September of 2018. So I want to talk about the grant a little bit. It is a 3-year grant, and it's funded through Library of Michigan. We are currently in our 2nd year. And so the main goals of our project here is we connect people to services and resources in the community. We also provide assistance to people. So when people come in and they're saying, I need help filing my Medicaid application, I need help applying for food stamps. Those are the types of things that we are doing. And then another level in there is we are developing collaborative relationships with local social service agencies. And so I'll give you an example of something that we have done and recently brought on more people on board with this. In our area, we have an agency that works with people who are experiencing housing crisis. And if you're familiar with our county, Berrien County, we have what's called a North County and we have what's called a South County. So there's about 30 miles in between our city, which is Niles, and the other twin cities, which is St. Joe and Benton Harbor, Michigan. So there are a lot of services in North County, in Benton Harbor and St. Joe. That is where the big courthouse is. That is where the unemployment office is. There's so many services that are there. And then when you come down to South County, where we are, we don't really have as many things available to people. So that creates this barrier for people who are trying to access services, especially if they don't have any transportation. So there's an agency that works with people who are experiencing housing crisis. And so what we've done here at the library is provided a space for that agency to offer services here at the library. So what they do, they're here once a week from 10 to 1. People who live in this area can come to the library and speak to case managers. They can speak to the agency staff about the crisis or the help that they're needing. And we found that that has been really effective and really helpful, because otherwise, how would people get to this agency to get the help or assistance that they need? So when I talk about developing collaborative relationships, that's a good example. When people come to see us, there's quite a few common requests. Like I mentioned, housing is probably one of our biggest concerns that we see people have. People are also often asking for assistance with completing Medicaid applications and applying for food benefits. Other things that people come to us for: job searches, unemployment, education. So things like, can you help me look over my resume? Can you help me fill out this job application online? So those are things that people are coming to see us for. I want to point out that we serve anyone who needs help. And we're often asked, well, who do you help? And we will help anyone who comes through our door. We'll do as much as we can to connect them to the right resources. We do not charge, because that's also another common question as well. We do not charge. Our services are free. And you do not have to be a card holder of the library to get help from us. You might say, okay, people are coming in and they are asking for help. Well, how does it work? How do you know people are wanting to see you? How do you know? So here's a little bit of what we're doing as well. We have a program called Book a Social Work Intern, and it was modeled after the library's Book a Librarian. And actually, our first BSW intern developed this program. And so what it is, it's a way for patrons and community members to make appointments with interns or myself according to schedule hours of availability. And we do and always have offered walk-in support as well. And this is something that we still use to this day. And so what it is people come in, we have a form, they can fill it out, they can leave their name, their number, and they can circle their area of concern, and it can be left for us to follow up with them if we're not available at that time. I do want to point out that as of yesterday, when I looked at the numbers, we have served more than 250 people through our program. And so I think that that's a great number, and I'm really proud of the work that we're doing. So Kristen, do you think we should try to take a few questions, if there's any, before we go on to here?
Sure, let's pause for a moment to do that. And while you guys are thinking of questions, I thought it might be helpful to know whether the libraries represented here have social workers. So I thought I'd put this little poll up, Tiffany.
Yes, that's great.
Let's see if people have social workers or not. Ooh, you guys are fast. This is kind of fun to watch. 36 people in 22 seconds. This has got to be a record.
Oh, that's a record for sure.
Right? And while we're waiting for those results to come in, there is a question. What happens when the grant runs out after 3 years?
Okay, sure. So the plan is for the library to sustain the social worker, but at the same time, they are also considering applying for other grants as well to assist with the funding, which I'm thrilled about, by the way.
That's excellent. Okay, I think our polling has tapered off, so let's see where we ended up.
Okay.
Share those results. And most people here do not.
Wow. Most people don't, 89%. Okay.
So for those of you who are listening in who have social workers in your system, it would be really interesting to know if they are grant funded or if that's part of the permanent budget of the library.
And you know, I also should say that in other areas, larger cities especially, I have seen social workers that are housed in libraries that actually work for other agencies. And so it's a partnership between the agency and the library where the social worker is housed there, but is employed by someone else, but still services the patrons at the library. So there's so many variations of social workers in libraries that you will see. And that's just one example of utilizing a social worker, not necessarily coming from funding from a library, but still library patrons having access to a social worker.
And here's a question. We also have the barrier of distance and no bus money for our patrons. Oakland is big and people tend to stay near our location in East Oakland. Can you go over again how you overcome the distance barriers when all the services are located too far away? Did you find an agency to help connect people? Also, do you hand out actual resources like bus money, laundry vouchers, emergency food, etc.?
Okay. So transportation is a huge barrier for many people, particularly in small and rural areas. And one of the things that we have done to try to help people with that is working with other agencies, bringing those services to this area, to our library. And I know we can't do that for every agency, but what we've done has been beneficial for so many people. So that is one way that we have been able to kind of eliminate a barrier for some people. In terms of actual resources, we actually do have transportation vouchers for our local dollar ride service. And so we are able to give those to people who come in who are needing to go somewhere, and they maybe don't have the money to ride the dollar ride to their appointment or to go get groceries. And so we do have some vouchers that we can give out. I also do keep a supply of snacks for people, because you would be so surprised at how many people come in and all they need is something to eat. Maybe they haven't had a meal all day and they just need something to settle their stomach and maybe help them focus a little bit more. So it's really hard to help people when their basic needs aren't being met. How can you expect someone to be able to focus on a conversation when maybe they haven't had a meal in a day or two? So I do try to keep those type of things. There are a few nonprofit organizations that have been so generous to bring hats, gloves, scarves, socks, non-perishable food items here. So I do keep those here for people that are in need. And I'm grateful to them for thinking about us. And it's so great to have that to offer people, even though it doesn't seem like it's much, but people are really grateful when you're able to give them something like that.
That's great. We have a question of how you measure success in a pilot program.
So what we've done, a couple of things were identified within our grant in order for us to show success. And so one of the things is tracking how many people that we see, and if we were able to refer them to a resource or not. And so I do track who we see and what area they are needing help with and what resource we were able to connect them with. Some of the other things that we are doing are tracking connecting points within the library systems. So we are looking at who we were working with before and who we have developed those relationships with throughout the program, and also what that has led to. So if it's led to a social service agency offering office time or something like that at the other library. So that's another way that we are tracking success as well.
And regarding the transportation, Tiffany, when this project was still in its incubation model, I remember talking to Nancy about how part of what you can do is help people like get everything organized before they get in the car to head to one of those towns that might be a service hub, as a way of minimizing the number of trips. So people
Yes.
don't take a half day off of work, get to the agency, realize they're missing paperwork.
Yes.
Did that actually come to pass?
Yes, in terms of what we're doing to help people, is that what you mean?
Yes.
Yes, and that is something that we do for people as well, and encourage people to let's go through the process. Let's look at your checklist to make sure you have everything. This means this. This probably means you should take this. Here's some documents. So we are doing that because, like you said, what's more frustrating than getting somewhere and not being able to get the service or have the help that you need because, let's say, you forgot your copy of your Social Security statement or something like that. So yeah, that is something that we continue to work and help people with.
That's awesome. There's a nice article in New York Times today about how hard it is for folks to navigate all of those government paperwork and government documents. I'll post that link in the chat.
Okay, sure.
Any other questions that we've missed? All right, then we're going to continue on.
Okay. So there are some things I think should be considered when looking at the idea or the concept of having a social worker in a library. And the first thing is patterns with patron needs. And I think this is really important to pay attention to and think about. Do people often ask, how to access services? Or are people often inquiring about help with certain things within your library? So it's important to pay attention to common concerns or issues that come up from patrons, because that will help see if, this is something that your library could benefit from. And I have to give a shout out to Nancy again, because she really paid attention to the patterns and the needs of the patrons here. And because of her attentiveness to that, she saw that we need to be able to help people. People see the library as a place of resource. And so what a great thing to be able to offer a resource to everyone and not have to turn away anyone who comes in. Another point is relationships matter. And I mean relationships with all parties. So relationship with your patrons, with social service agencies in your community, with local universities, all of those type of places. And again, I'm doing a lot of tooting Nancy's horn today, but I think it's really justifiable because she worked very hard to build relationships with those types of agencies and community partners and stakeholders. And I really believe that developing those relationships will help with the buy-in. It will help with people understanding the need for something like this. It really is about collaborating together to see how can we serve our community and how can we serve our patrons better. Another thing is it's okay to start small. You may not be able to hire a full-time social worker. In fact, most libraries probably cannot. But it's important to explore other options and think about what can you do to start small and still meet the need of people. So maybe a social work intern or even a social work volunteer, someone that has social work experience that can volunteer some time, a couple hours a week, to assist people that are coming in. I also wanted to mention bachelor's level versus master's level. And so BSW is a bachelor's level social worker and MSW is a master's level social work. And again, this is where developing relationships with universities will really come in handy, because social workers have a scope of practice based on education level. So there are certain things that a bachelor's level social worker can do, and there are certain things that a master's level social worker can do. And depending on what your needs are, you may be able to utilize a bachelor's level social worker or a bachelor's level intern. I've been able to utilize both this year. Last year, I had 2 master's level interns, and this year I have 2 master's level and 1 bachelor's level. And it's been a great experience for them both. But that's where the relationship with local universities or School of Social Works will come in handy, because they will be able to guide and help you understand what a social worker can do, what a bachelor's level can do, what a master's level can do. And that kind of ties into the next point there, developing those relationships. Western Michigan University is a partner within our grant and has been very helpful to engage students, getting the word out about this emerging field, and also to have their input on our practices and our procedures as well, because we want to make sure that we're operating under the best practices and the best standards as guided by our Code of Ethics for social workers. Another thing is ethical considerations. And what I want to point out here is that social workers are mandated reporters. And so oftentimes we may encounter a situation where we suspect that there may be abuse or neglect of a child or an adult. It is our obligation to report that. And I understand that in the library world, that's a little bit different. But as social workers, we are bound by our code of ethics to report things like that. And so I just think that that's something that should be considered and thought about when bringing on a social worker. It's an important conversation to have about what that looks like and what that means for a social worker in terms of any consequences for not reporting certain things, and conversations such as that. It's really important. And the last thing, probably one of the first things to consider, would be confidentiality. And that's maintaining privacy in a public space. This is very important because you will have people coming, sharing sensitive and personal information. And so I think that that's really important if you are considering having a social worker in your library. Think about what your space is like and think about designating private areas for a social worker or an intern to engage with people, so where that person feels that they are in a safe space and that their information and conversation will be held confidential. So, do any of you have any other questions? And I do have some key takeaways here. Kristen, should I go ahead and talk about those?
Sure.
Okay. So some of the key takeaways here, things that I think are really important, and that is that relationships matter. And so I spoke about relationships with social service agencies, with community stakeholders, with universities. Relationships really matter. And when you build that relationship with people and you show that you have a common ground and you're trying to do good and serve the better and be there for people and help people have resources and making things available to people who are our most vulnerable, I think that is really essential when having the conversation about bringing something like this on board. Also, I would encourage everybody to explore possibilities to create something that will work for your library. So, like I mentioned earlier, it may be a volunteer, it could be an intern. Think about things that will work for your library. It doesn't have to be a full-time social worker, but maybe it's a BSW intern or a volunteer. And then also understanding the needs of your community and patrons and get to know the resources. I can't speak enough about knowing what's available in your community and also knowing the needs of your community and your patrons. So it's important to listen and pay attention to those patterns and think about, what are people asking for help with the most? What kind of concerns are people coming with the most? But once you have an understanding of that, then you will know if a social worker is needed at your library and maybe some avenues you can take to help people be connected to the resources and the information and the help that they're looking for.
We're getting a couple of questions about whether the webinar will be archived. And absolutely, within about 48 hours, you'll get an email that will link you to the YouTube archived version of this presentation. So we're excited to hear that it will be helpful for you in the future. We've got a couple of questions. Does one need to be a licensed social worker on staff? They use the abbreviation LSCW. on staff to supervise the interns, or can they be supervised by faculty members at their school, especially for a formal internship where they might be getting credit?
So I will use the example of when our pilot intern began. And so at that time, there was not a social worker here. And so, yes, she was able to have a secondary field instructor, is what it's called. And that is someone who does have the credentials to monitor her work here and have supervision with her. She still had someone in the library that was her direct report, but that person and the person with the social work credentials worked together to provide supervision for her. So yes, it is possible.
Thanks. Another question from JL Severe. Are interns limited in the work they can do? We're starting with one in the fall. Wondering if there are things we can't have her do.
So I would ask what level she is. Is she a bachelor's level or is she a master's level? That would be my first question.
And while we wait for the answer, what are the limitations? Oh, master's level, he said.
Okay.
This person says.
Master's level. So master's level are able to do a little bit more than bachelor's level. So things that I'll give you some examples of what a master's level can do. So they can do administration and interpretation of assessments. They can lead groups. They can do research. They can do did I say groups already? I'm sorry. I'm trying to look across my room at my list.
Go ahead and repeat yourself.
Okay, so here's a couple of things that master's level can do. Sorry, I grabbed my list, so I didn't have to try to squint so far. They can do advocacy, they can do case intervention, case management, they can do assessments and recommendations, organizations, community organization, and they can also lead groups. So if you are wanting a little bit more detail, I would be happy to share the scope of practice, because there's probably about 25 to 30 things that are on this list, and it indicates what a bachelor's level versus a master's level can do. So I'd be happy to share that with you.
Yeah, that would be helpful. We can send it out with the archive link.
Okay.
The next question comes from, how do you book a social worker? This is from Emily. Is it by phone, at the desk, online?
So in our library and at the other partner libraries, we have our information throughout the library. So we have postcards that advertise what we do and also times that interns are available, along with our Book of Social Work intern request form. So it's actually a form that is throughout the library as well as outside of our door that people can fill out and leave either under our door, or if they're comfortable enough, they can give it to a staff member and the staff will leave it for us as well. We do have email addresses as well, so people can contact us via email, and people also do call us to schedule appointments as well.
Great. The next question is, what type of shift, number of hours do you work in your library? And can you give us sort of an abbreviated synopsis of what a typical day looks like?
Sure. So my hours are pretty flexible in terms of being available when the interns are available. So I generally work about 9 in the morning when our library opens until about 6. However, there are some days that I stay in the evening as well. Our interns are at the other libraries throughout the day during the week. They have daytime hours, and then we also have an intern that has evening hours, and then we also do some coverage on the weekends as well. So we try to have our hours varied enough so that people who may work during the day will have a chance to speak with us in the evening when they get off, and vice versa. And then people who work during the week will have a chance to come and talk to us on Saturdays as well. And a typical day, honestly, every day is different. We really never know what things people might walk in and ask us for help with. So a typical day just involves us coming in, responding to any messages that were left, any request forms that we received while we weren't here, following up on those things. And then if people are here or are waiting for us, providing the assistance to them. Myself, I do attend a lot of meetings. I am on quite a few committees and trying to spread the word about what we're doing. So my schedule allows for me to go and spread the word about our program to other places as well. So no day is really the same. It just really depends on how many people we have that are needing assistance.
That's really great. Anything else from you guys? You've been asking great questions. And Tiffany's also given her email address, which I'll paste in the chat.
Yes, feel free to email me if you have any further questions, or if you would like to have conversation about what this might look like for you in your library. I would be glad to help you.
And while we see if there's any final questions, I've been posting in the chat a couple of potential future resources. One being, we have webinars coming up in February and March. The February webinar is going to be about web accessibility, especially given that our elderly population is going to be growing in the next 20 years. We want to make sure that our websites, our Google presentations, our Facebook posts are accessible to those with limited vision impairments or limited mobility. And we're really excited to have Colleen Van Lent talk about that. Colleen has been named, her course is one of the top 100 MOOCs of all time. And she's a wonderful, accessible guide to how we can be more accessible in our digital world. In March, I'm really excited. Megha Subramanian is coming to talk about design thinking. And those Eventbrite links for registration are in the chat. And also, I've put a link to the evaluation form, because we actually have to give data back to IMLS, our funders, about how things are going. So we hope you'll help us with that. And finally, Tiffany is right on the money about connecting with universities. And just to get a sense of what UMSI, as one of the host organizations here, has for client opportunities. Our school is growing every year. I'm putting that link in as well. Things like web evaluation and having usability testing done are the kinds of things we can do with clients nationally and internationally. So now that I've given folks a minute to think, we do have one more question, and we'll call this one the last one. How long do the typical sessions with social workers last?
Well, the sessions really vary based on the person's need. We don't have any time limits, so we are able to spend time with people as much as they need. It depends on what it is that they are looking for or asking for help with. You know, some people come in with a really quick question. They just maybe need a phone number or an address to an agency, and so we're happy to provide that for them. But then the things that take a little bit longer might be assisting people with an online application, so applying for Medicaid or applying for food assistance. Those type of things take a little bit longer, but we don't have a time limit, so we're glad to help people. We fortunately haven't had too many problems where there's been people waiting for a long time to access one of us, so it has worked out well with not restricting any times, and I feel really good about being able to provide that service to people, because oftentimes when you go somewhere else, like if you go to a doctor's appointment, you know, you're limited with your time. And so we really want to give people the opportunity to ask the questions that they need to understand what it is that they're looking for, and then also know that they're prepared and that they're ready to go and talk to whoever it is at another agency, and they have everything that they need, and they know how to ask questions, know which questions to ask, and what they maybe need to take with them. So I think that hopefully we never really have to limit our time, and hopefully we can just help people as much as they need to be helped.
And that's a great point for us to end on. So thank you so much, folks, for joining us. We hope you'll join us for our upcoming webinars, and we'll email you a link to the archive version within about 48 hours. Thanks so much, guys.
Thank you, everyone.